upgrading and making them to be a very good to be a good homeopaths, expanding education and training, increasing patients access to homeopathic treatment. So this was about and even I can tell about what I you can do in IIHP: academic work, professional development, public health activities, organizational work, and community and research contribution. By life membership, there is a small amount of life membership by which we can join IIHP. Now here I am introducing I am Dr. myself, Dr. Shivani Parikh from Vadodara. I am the president of Gujarat State Branch. Here, very good evening to all once again. Here, I welcome you all, and also I welcome the esteemed today's esteemed speaker, which I will announce after some time. Here in Gujarat, we had launched the Gujarat IIHP State Branch in the month of 8th February. At that time, it was introduced to me by Dr. Samir Chokar, and he just told me one day that, Dr. Shivani, we can do this way, and this is how we started the association with the 12 group members and the 12 core members, and this is how we started the IHP Gujarat State Branch. We had done many activities. First, we had done the induction program, then we did yoga integration program with homeopathy, we did camps, even we did webinar of Dr. Ronak Shah sir. Even we did online webinars also. This is the second webinar of our today's esteemed speaker, Dr. Vijay Krishnan sir. So this is how we do the programs, and further programs are also going to be done. Also, we do the educational trips also. So these are our future plans. This is what the Gujarat II state branch is doing. I'm showing the activities what we are doing. So this is what. Now today I will speak about, give the introduction about Dr. Vijay Krishnan sir. Very good evening to all. Myself, Dr. Shivani here. Here welcomes you as esteemed speaker, as well as a very well known speaker, Dr. Vijay Krishnan sir, who is the professor, PG guide, and national speaker, and a very good practitioner. He is a very good practitioner at Bangalore. He has clinical experience or teaching experience about 26 years, and clinical experience about 27 years. Now, I would quickly go ahead about his academics and administrative contribution. He is a board member at Rajiv Gandhi University. Uh, he has completed short course in educational methodology for Ayush teachers at Rajiv Gandhi University. He is active contributor in question bank preparation at Rajiv Gandhi University, and he is also attend foundation course in educational methodology at Rajiv Gandhi University. Regular question paper setter at Rajiv Gandhi University, Kerala University, and Yenipoya University. He is also a nodal officer, coordinator of ROTP programs, Government of Karnataka. He also handles the subjects expert in framing CBDC syllabus for homeopathic materia medica for BHMS UG students. Member expert committee for the practice of medicine with essential pharmacology, NCH New Delhi. He is also a resource person at ROTP at MLAA Palghar in 2022. Even the CME programs, Homeopathic University at Jaipur. Further, little more, he is a guide since 26, professor and PG guide also since 2007 till date. And also he had been as a lecturer in Bhagwan Buddha Homeopathic Medical College. So this is what his short, brief introduction I had given, and he is esteemed. Recently, he had come to the Parul University. We had a very good national seminar. Uh, so he is very well known person, and very good practitioner. So I welcome here, sir.
Thank you. Thank you. Thank you so much.
Welcome, sir.
Thank you.
Very good evening, Dr. Samir Chokar, sir.
Yeah, good evening to everybody.
Sir,
Dr.
your
Vijay
voice is
Krishna,
not.
welcome.
Thank you so much.
I did not want to miss your webinar, so I'm attending it from Istanbul. I've just landed in Istanbul.
Thank you so much. Means a lot.
So just checked in the hotel and now I thought immediately I should join.
Thank you.
So welcome, sir. We won't take too much time. Your introduction can go for 2 hours, but we want to learn something more from you. So
Thank you.
please start, sir. Thank you very
Thank
much.
you. Thank you. Yeah, very good evening. Thank you, ma'am, for a nice introduction, and thank you, Samir sir, for joining from Istanbul. It means a lot. Okay, so without wasting much time, we have a lot of things to discuss, a lot of things to share and learn together. So I'll directly start off with a case. Good evening, all, and welcome to this webinar. See, the only hiccup we have in webinars is many times it is one way. Okay, so we will try to make an effort where we will try to have a small exchange of our views, and I'll try to keep it very simple, and we'll try to keep it very practical. You have a chat box which is there. Please use the chat box. Please keep a small book and pen with you so that whatever case I am narrating, please make a note of important points that you feel, and then we will have a discussion. Okay. So once again, welcome, and I'll straight away start with a small case. So this, see, like homeopathy is a small community, and a speaker generally he has some doctors, some students who believe in him and who follow him. So I have tried to get all new cases so that doctors, delegates, and the students who are attending will not feel that there is a repetition. So I am trying my best to keep. Okay. So this is a small case of a girl aged around 20 years. Recent case, last 15 days back, she had come and she had bad vomiting. Please concentrate. And she is not even able to retain water. So this was her problem. She has been having loose stools for last 4 to 5 times since morning. And her sister is a student of mine. She is a homeopathic student. And she had prescribed some remedies. She had called me over phone. I had also told her to give some medicines. And unfortunately, she did not improve. Keeping the dehydration in mind, they rushed her to an allopath who gave her IV antiemetics, but the vomiting persisted. They were planning to admit her in an hospital. They stay some 80 90 kilometers away from my clinic, but this young girl was insisting to see me, and so they had to literally drive all the way to meet me. Okay, so this is the case. So I need your help. How do we proceed? As a homeopathic student, how do we proceed with this particular case? I've told you, please feel free to use the chat box so that we have some kind of interaction. I'm also trying to locate the chat box. 1 second. Let me see where it is. Okay, where are you? 1 second. 1 second. So Okay. So, 1 second. Right now, um, yeah, 1 second. Let me just see because I'm trying to locate the chat box.
Yes.
Okay.
There is a question and answer
Yeah.
thing. I
Uh,
think they can put their answers or queries there.
yeah, true. But then, 1 second, 1 second. Yeah, yeah, this has come. Now I'll have to see where the PPT has gone. Just
Some
1 second.
somebody has written any outside food intake. I
Yeah,
would like to ask
yeah,
you.
very good. Any outside food? Okay, it makes sense. Hmm, the chat box. Okay, any outside food? Okay, so you have Q&A. That's where you can start typing.
Yeah, yeah,
Okay, so chat box is not available here. I understand, but Q&A is there, so you can use that option and you can start giving your. Okay, 1 second. Yeah, I'll come back.
yeah. Somebody asked, sir, what triggered the ailment? Somebody asked, detailed history should be taken.
Okay, very good.
Character or contents of vomiting. How many times is
Okay,
an
good. Yeah.
ailment? Should.
Okay, very good. It makes sense.
Are you able
So,
to see it, sir? Question
sir,
answer.
yeah, just continue to share. 1 second, sir. Yeah. So this is a little tricky. Okay, fine. So there are, yes, as Samir sir rightly said, a lot of things. What is the ailment? Any investigations? Okay, all these things, very good. It makes sense. So, so appreciate your, interaction. We'll go ahead. So what we saw here is is see now the first question that should come to your mind. Once you are done with case taking, what is that first thing that you are going to do? See, the first thing as a homeopathic physician, all of us should keep in mind the first thing that we need to do is we need to classify the given case. Dr. Hahnemann, in his organon, he has beautifully classified. I'm not going into the details because you all know, but as a practitioner, what I'm trying to tell you is the classification of the entire disease or entire illness broadly. I repeat, broadly, it can be divided into three. So, what are those three broad classification of an illness? Sorry, I was a little quick. So, as you know, the broad classification, if you're looking at, is first we have indisposition, and then we have acutes, and then we have chronic. Okay, so this is how the diseases are broadly classified. Okay, so moving forward, now why this classification is required? If I can ask you, why do we classify? Why do we classify diseases? So a lot of answers coming in. Okay. Hope my volume, my voice, my language is clear because next 1 to 1.5 hours you will have to listen to me. If you feel there is a need for some small changes, please let me know. I can accordingly change so that you will have no disturbance from the technical point of view. Okay, so the classification, basically if you see, the classification is done because the approach for all the three are very different. If it is indisposition, as per the knowledge of Dr. Hahnemann, you have a different approach. If it is acutes, you have a different approach, and if it is chronic, you have a different approach. So this is what I was just trying to tell you. Now we'll come back to the case. Many of you have given your inputs. Okay. Now what is this case that we have in front of us? Is it indisposition? Is it acute or is it chronic? Chronic is ruled out because you see it is a small duration. I'll explain what an acute is a little later, but we'll understand the case, we'll solve the case. So as you see here, it is more of acute. Yeah, there are a lot of things coming up. Okay, good. Okay, good. Very good. So our approach will be different. Very good. Absolutely right. So is it indisposition? So what is indisposition? See, indisposition, Hope we are all qualified homeopathic students that who are attending. Hope they're all qualified students and doctors. Okay. Hope it's not open for public. Fine. Then otherwise we'll have difficulty explaining in this position. From there, if we start, things will take a different turn. Okay. So indisposition is when a person is sick, indisposed. Like for example, a small change in diet. You eat something out, you have read whole day, and next day you feel weak, you feel tired. You rest for one more day and you feel better. So there is no need for medication when it comes to indisposition. Okay. So this girl had lot of vomiting, lot of dehydration. So she is out of that indisposition area. She falls into an acute case. Okay. So you can see that they were planning to admit her. She was badly dehydrated. So my assistant doctor had taken this case. I was in the other chamber seeing another patient. So this is the case the girl is giving. Every time before exams, I have this problem. I have nausea, I have vomiting. I could not sleep the previous night. Before all the vomiting started, the previous night she could not sleep. In my sleep, I think I have not written anything. Please make a note. I am reading the case and we'll have to interact once I am done with the case. I forgot the answer. I get such dreams. In dreams, this is what she is getting, and that is disturbing her sleep. I am very fearful of exams. Similar episodes happened before all exams. Pain in chest, not able to breathe, vomiting, pain abdomen, vomiting immediately after drinking. So this is the history collected by my assistant doctor. Okay. So now I enter the chamber. Okay. And what I observe, please mind you, when you are dealing, especially with acute cases or any case, your observation skills should be very, very good. Okay. So what is that observation I did when I entered the assistant doctor's cabin is that the patient, who was resting her head against the shoulder of the sister who is a homeopathic student, and she was holding her hands. Okay. I just saw this and I inquired further, and the homeopathic student, she told, sir, from morning, my sister wants me around her and she is not letting me, get away of her sight. She wants me to sit next to her. She wants me to be with her. This is my observation. And in the previous slides, I have given you the history taken by my assistant. Okay. My remedy is done. I am not prejudiced, but I have few rubrics, and I'll appreciate if you also come up with your own interpretation. A lot of you have given remedies. One small request: please don't jump to remedies. You'll be seeing the cases that I'm going to show. There are remedies which are beautiful remedies which come up. So the first thing you'll have to understand is take the history, go Hahnemannian way, repertorize, convert the patient history into repertorial totality, and then definitely you'll have a set of remedies coming up. Then we'll differentiate with the knowledge of materia medica. This is the conventional, no shortcuts, and trust me, you have beautiful cases lined up. Okay. So a lot of people telling, sir, clinging to attendant, beautiful. Somebody has told bismuth, want of consolation. Yes, absolutely right. Good. So we will keep this interaction alive and will continue. So there's a beautiful proverb. The eye sees what only the mind is prepared to comprehend. So the girl is holding the hand of the sister. She is on her shoulder. If you do not understand what this means, then your eyes will not even look at it. I hope you appreciate what I'm trying to tell. So the observation skills are very, very important. Okay. So this is a beautiful quote. You can make a note of this particular quote. And You have given me a set of rubrics. The funda of today's webinar is to keep things simple. Homeopathy is very simple. Please do not complicate homeopathy. Done? So, what you see is what you take, and what you take is what you prescribe, and you will see the results. You have already given the remedy, you have already given the rubrics. Hats off to you all. Okay, but I'll tell you what I had taken. I had taken two very small rubrics. If you feel there's something new, please take a pic of it. I have no issues. Don't share it on social media. I have videos of all these patients, but unfortunately, I cannot share because of the issues which have come up of late. But I am trying to give you those cases where one or the other way they're all there listening to the webinar today. This final year student is there. She has given me permission to share this case. I'll be sharing one homeopath's father, one homeopath's daughter, all who are there, so that they all feel that yes, their case is discussed, and they have given permission. So my job is easy, okay, because it's going to the public domain. So two rubrics are taken: fear examination before, and this was what was very evident. This was taken, and second thing what I saw was smallest quantity, even water or drinking, she would vomit. She would vomit. Okay. And you see phosphorus, you see arsenic, you see silicea, you see antimonium tartaricum. Four remedies which have come up. Now your knowledge of materia medica becomes very important. Now, what is that knowledge of materia medica? Is she arsenic? Is she silicea? Is she antimonium tartaricum? Now, this is where I add another rubric here, and that is the rubric majority of you have got it right. And I want a remedy which is clingy. So, the only remedies which cling out of these four, one is phosphorus and the other one is antimonium tartaricum. Make a note: antim tart clings during respiratory complaints. I can give you many cases. Clinging during respiratory complaints, single remedy rubric, antim tart. So we had another small totality that we made. The child, I mean the lady, young lady was looking dull. She wanted to drink. If she drinks, she is vomiting. She has thirst. She can't drink, and if she drinks, she is vomiting. She is chilly and she is clingy. I ruled out arsenic because there was no anxiety. Okay, if it was arsenic, she would not driven asked her parents to drive 90 kilometers to see me. If she was arsenic, she would have got admitted immediately. Please, these are the valid points how you differentiate. If it was arsenic, she wouldn't have come this far to me. Okay, fine. So she is phosphorus in the acute state. So phosphorus was given by, I mean, they came around 7:38. By 9:30, 10, she was absolutely fine. Next day morning, she ate normal solid food and she was fine. Phosphorus 1 m single dose. Potency, repetition, dosage, everything in an acute, very, very important. So phosphorus 1 m. Done? Done? Okay. And she was absolutely fine after this. Then it's a repetitive thing that has been happening. Then we asked her to come back after a few days. We took her entire case in detail and she was prescribed Bareta Muir as a constitution. I am not telling you why Bareta Muir for time being, because it's a chronic prescription. We'll look at it later in some other session. Now focus is on acutes. Hope you are clear with the first case that we just started. And the topic for today's session is mastering approach to acute illness with homeopathy. This is the title, and hopefully, you know, one of you from the organizing committee, please make a note of the questions they're asking. So Shivani ma'am was telling we'll have some time in the end. So whatever relevant questions, we'll definitely take up those questions. Okay. So we'll quickly move with the presentation. Okay. So the physician's high and only mission is to restore the sick to health to cure, as it is termed. Beautiful aphorism, means a lot. Okay, so I hope majority of you know what exactly this aphorism is all about. Similar similibus curanter, we classify diseases because each individual is different, and each individual how he presents in an acute, in a chronic, is what is peculiar with homeopathy. Similia similibus curanter. Okay, now before we get into the presentation a little more seriously, I would like to take the blessings of this great man who introduced this beautiful science, homeopathy. Okay, and my teacher, my guru, fine, without whom I wouldn't have understood homeopathy. And physically is no more, but dynamically is there with all of us and guiding us. My teacher, Vijay Karsar, and whatever cases I am showing today is all dedicated to these two great people. And few days back it was Hanuman sir's death anniversary, and next month it is Vijay Karsar's birth anniversary. And coincidentally, IIHP they have invited me for a webinar. So, taking blessings of these two great men, we'll be moving further. Two or three slides, I'll just tell you what an acute disease is. I request the seniors to bear with me only for two or three slides, because Shivani ma'am and the other organizers, they were telling today's webinar has good amount of students. So I have to balance students, and of course we also have a lot of speakers. Muktinder sir, I don't know who are all there joined today. We have to cater for both of them. So I am not reading this as you see here in the PPT. He talks about acute diseases. He means Dr. Hanuman sir talks about acute diseases in aphorism number 73. And he says acute diseases are those rapid morbid processes of the abnormally deranged vital force which have a short course and come to a natural conclusion. Either they end in recovery or they end in death. Now, this is where the seriousness of acute diseases are. If you don't treat them well, they can land up into a serious state. So you'll have to be very, very responsible. Okay. So moving forward, see, you all know acute diseases. If I can ask you again a small interaction, acute diseases, how are they divided? What is the basic division of acute diseases as per organon? So Hanuman sir divides acute diseases into three main varieties: individual acute diseases, and our focus today is on this particular type of acute disease, which is individual acute disease. Arises in a single person due to harmful influence. Some ailment will be there, very important. We'll discuss that. And then we have sporadic. This is diseases that are seen in a very small area. Okay, like for example, few of them having rabies, few of them having tetanus in the community. And then we have epidemic, which covers a larger community. Okay, like for example, chicken pox or measles, all those things. Okay, these are the basic classification. And I and i just told you that our focus will be on the individual acute diseases. Okay, so what are all the common acute diseases? You get to see again a small interaction. What is it that you see in your clinics? What are all the common acute complaints you get to see in your clinics? Can I have the question and answer session where you type, so that I know you're all there on a Sunday evening with me, listening to me? And yeah, very good. Dr. Kanika, Dr. Abhishek, Dr. Anaga. Yes, very good. Yeah, plenty of names, plenty of acute conditions that we see. Good. Thank you. Appreciate. So keep it going. Okay, we have another question for you. What are all the common acute remedies we use in our day-to-day practice? You have given me the acute conditions. I've gone one step ahead and I'm asking you what are all the remedies. Yes, very good. See, acute means it should be sudden. And I'm happy. Your answers are also very sudden. You're not taking much time. Good. Very good. Keep it up. Appreciate. Good. Yeah, yeah. I mean, 504 participants, and you're all. Yes, thank you. Yes, good. So we'll go ahead. Now, this chart again, you can take a pic if you want. This is what I have learned from Vijay sir. This is what I have learned from predictive homeopathy. And this is how we classify an acute disease into. So acute disease, if you just see this, are classified into simple acutes. Now, whatever you have told, like, simple cough, colic, UTI, diarrhea, they all come under simple acutes. Okay. And a few of you are talking about other conditions, like we have complicated acutes, dengue, jaundice, typhoid, malaria. The approach is different here. We have acute emergencies, like for example, appendicitis, acute abdomen, MI, acute renal failure, acute coma. These are all acute emergencies. And then we have acute mental diseases, like panic attacks, acute anxiety, acute mania. Hope my speed is okay. And Muktinder sir, is it okay if we continue beyond 9? Because will that be a problem? 9:30, is that okay, sir? Anybody from the organizers, if you can confirm, if you can go till 9:30, because we have some cases. Okay, till they confirm, or if they are not answered, meaning yes, we'll take it as yes, we'll go ahead. Acutes which comes during chronic diseases. Okay, see, the approach for all these things are different. Okay, so you can click a pick, we'll go ahead. And these are all the session objectives. I'll be a little quick. Classifying acute disease, we have done that. And we will look into cases primarily today. Okay, so we'll again take up a fresh case which had come very recently. A 15-year-old boy who had a cough, and he had cough for last 15 days, and he consulted some doctor who had prescribed him antibiotic, and he had no relief. Okay, so he was there in my clinic in front of me sitting, and mother was explaining about him. See, this is what Vijay sir would tell. Our sense organ should be very, very sharp, very, very acute. I was listening to the mom. One ear was towards the boy. Okay. So what I saw in this case, it's a beautiful statement. To acquire knowledge, one must study, but to acquire wisdom, one must observe. So just studying will only give you knowledge, but observing will also give you wisdom. A very beautiful quote, makes a lot of sense. I'll take you to aphorism number 153. You can make a note. I'm not going into the details. We don't have much time. Sir, when I say sir, is Vijay sir. Sir would always insist in acutes, you should you should look for more striking, singular, uncommon, and peculiar characteristic sign or a symptom. Now, what I saw when mother was explaining, this guy would cough, but the cough would be a single cough. Please make a note. The cough would be a single cough. That's it. And many of you know the remedy. And the remedy, you would have guessed it also, right? The remedy is calcarea carp. Now, how do you see in your repertory? Cough chapter, paroxysmal, then you have single. You have a single remedy mentioned there, and that is calcarea carp. So this boy was given calcarea carp with beautiful results. Okay, cough, single paroxysm. I'll share few cases of cough, and then we'll go ahead. This again is a homeopath. I am not sure if she's there or not, but then she came on again 26th, and she had bad cough. She had tickling, and she told me something very peculiar, because See, the potency generally in acutes, I give 1M, and generally in acutes, I don't see the need for repetition. There are cases where I've repeated, must be in question and answer session. We'll look at it. But whenever I say a remedy, you have to take it for granted that it is single dose and it is 1M. If I have repeated, I'll tell you I have repeated. Otherwise, if I don't use the word repeated, it means 1M single dose. Hope I'm clear. Okay. So this homeopath, she was telling something very peculiar. She said, "Sir, I have itching here, and then I start getting cough." We converted this into a rubric, and this is the rubric I had taken. So she said that this tickling goes down here to the chest, and then she starts coughing. The remedy that was coming up there was silesia. I prescribed her silesia, and I felt very happy, proud. I've discovered a beautiful rubric and I prescribed. But unfortunately, she came back 2 days back. That was 3rd of July, 2 days back, and she told, "Sir, cough is not fine." And in between, she's taken a lot of remedies, Drosera, Spongia, whatever remedies I told for cough in my class, all those remedies she has taken. But unfortunately, she was not better. She again came back day before, telling, "Sir, cough is not fine." So I was just again retaking the case and trying to build up a small acute totality. Please see what has come up and please come up with the probable rubrics. Cough was not better. She being a homeopath, she has taken few remedies. On further inquiry, she told, "Sir, cough starts with tickling sensation in the throat." Please mind you, listen to the next word. Tickling only in the right side of the throat. Tickling only in the right side of the throat. She had very deep cough, she had very dry cough. Dry, deep cough, and tickling mainly in the right side of the throat. Now, please come up with your answers. What could be the probable rubric that you are going to take here? How do you convert this into a rubric? See, there is tickling and there is also irritation. You'll have to understand the difference. Tickling is something very superficial, like as if some feather, something very superficial. But when you're talking about itching, irritation, that is something little more deeper. Okay. So spongy all given taken. I told you she's taken it. Tickling right side. Okay, very good. Very good. Okay. So she was also telling me. Yeah, sorry, one second, one second. Let me not disclose this immediately. So she was also trying to tell me one thing, sir. Off late, like last 2 3 days, sir, I've started getting the smell of cut onions. She's sitting in clinic in front of me and she's telling, "Sir, I'm getting a smell of cut onions." See, you are cooking at home, you are cutting the onions, you get smell of onions, it makes sense. She's sitting in front of me in my clinic and she said, telling me, "Sir, I'm getting smell of onion." This was also a tricky rubric to convert. I did search, I typed onion, etc. Unfortunately, I did not get. I took a broader rubric. I'll be sharing the rubric with you. The rubric I took, the broader rubric was smell, odor, imaginary. And then I took cough, dry. And then I took cough, tickling, throat from right. See, I told you, when we started the webinar, we all jump with remedies. And this is one case which has again taught me, Vijay, don't jump with remedies. Vijay, take the rubrics. See what is the surprise remedy that has come up. The surprise remedy that has come up is diascoria. Trust me, 26 or 27 years into practice, diascoria that I have used, to be honest, is mainly GA. I have never had an idea that diascoria has action on respiratory. I'm very honest with you. I'm a material teacher, but I have never taught students about diascoria cough, but my repertorial totality is showing diascoria cough. So I took a small pause. I opened source books. I was reading. Does diascoria really has cough? Is the diascoria cough matching with the cough of my patient? And then I prescribed. So, so even today I called her because I'm giving the webinar. So I just wanted to understand what she felt after diascoria. And she says, sir, much better. Okay, cough is much better. Only single dose of diascoria was given. And little about diascoria cough. See, the only disadvantage is I'm telling one way, but this is what we miss, the facial expressions. Did you understand? Are you in a shock? Diascoria for cough? Or are you excited? I'm reading a new remedy, diascoria. So that eye contact and that emotions is what we generally miss in a webinar. Okay. But the diascoria, please understand, irritation in throat. What is it? Irritation in throat, right side. So when somebody is coming to your clinic telling, sir, throat irritates, and then I get cough, and the irritation is only on the right hand side, then the remedy is diascoria. Single remedy rubric, diascoria. Okay. Irritation in the lungs. See, irritation in the lungs at 8 p.m. So there is irritation in the lungs at 8 p.m. and then they get cough. The only remedy you have in your materia medica is diascoria. Tickling in right side. So tickling in right side of the throat giving rise to cough. You also have one more remedy, and that remedy is baptisia. Okay. But baptisia got eliminated. I'll show you the repertorial totality. Once I added few more symptoms of the patient. And the character of cough in diascoria is very deep, very dry, and cough at 6:30 p.m. Again, single remedy rubric, diascoria. Cough at 6:30 p.m. And during cough, they will have bad headaches. During cough, they can have pain in ears, and during cough, they can have pain in stomach. So this is the cough of Diascoria villosa. Hope I am clear. Okay. So we will move to the next case. Short cases because they're acute. You'll have to give results fast. A lady aged around 30. Again, I need your help in solving this case. A lady aged around 30 years presented with severe cough. Okay, date of case taking. I told you all recent cases. She had been to Rishikesh and then she came to Delhi. So people who go from Rishikesh and then they come back to Delhi, do they come up with cough? Okay. So we were trying to understand what happened. So then the reason she gave me was sir, Rishikesh is is the temperature in Rishikesh was -10, and the temperature when I came to Delhi was 40 plus, and that's how, or that's when I started having cough. Now, can I have the answers for this particular situation? So from -10, she's come to Delhi and then she's been having cough. So what remedies, what rubrics, how do you solve this simple case? Yeah, I'll open the question and answer session. Yes, beautiful, dull camera. See, dull camera, I also made the same mistake when I thought about this. But why not dull camera? Beautiful, somebody is talking about bryonia. Yes, why not dull camera and why bryonia? So the answer you get when you repertorize. So what is the rubric? The exciting cause, aphorism number 5. Everything should be organon based. Aphorism number 5, beautiful. Then we'll go ahead. Yeah, I'll not read the aphorism. Please make a note of the aphorism. Now, please understand the situation. She was in the cold environment and then she came to the hot and then she had cough. Okay. So the rubric I took was generalities, change of weather, aggravation, cold to warm. And you see a set of remedies coming up there. So again, dull, hot, thirsty. Okay. And dry cough. Many of you have got it right. The remedy prescribed was bryonia with beautiful improvement. So any change of weather, please don't jump to dull camera. Dull camera will be from hot to cold. For example, from Delhi, she went to Rishikesh. In Rishikesh, she had cough. Then it would have been dull camera. Hope I'm clear. See, the idea of IIHP organizing, I accepting their invitation is you need to have a clarity with small things. If I would have given dull camera, then she wouldn't have improved. Similia similibus curanter. Only the right remedy can do wonders. Okay, so we'll go ahead. Lot of other cases. So this is a beautiful case. I was taking case and then my receptionist rushed to my chamber telling, sir, we have an emergency case. See, very rarely, to be honest, we have emergencies coming into our clinics. Okay, fine. So we had this 26-year-old girl who is our patient, and she was in a very panicky state, mother, daughter, and then she told us, sir, snake has bitten me. And she was crying, she was restless, hope nothing will happen, no doctor, blah, blah, blah. She was going on and on. Now tell me, how do you, now from simple, we are getting into a serious mode. Now, how do you solve this case? 26-year-old girl coming to your clinic. So should you give lacases, snake bite? Should you give something else? What do you do? How do you go ahead? Beautiful. I have got answers. Somebody is telling Cedron. Very good. Cedron. Any other inputs? Any other inputs? See, first you understand the approach. What is it that we are missing as a homeopath? Is understand na what exactly it is. I'll show you the image. Knowledge of disease. See, very important is don't give Cedron, don't give lacasis, don't give Crotellus horridus, don't give ledum. Examine. Okay. Now, why we did not examine? Because we did not have the knowledge of disease. And I also was trying to play with your confidence. Tell me the remedy, tell me the remedy. But you should have told, sir, forget about the remedy. First, let's see what the issue is. Let me examine. Where did the snake bite? Okay, fine. If it was a real snake that had bitten, do you think the girl would have been in that particular state? All these questions should come to your mind. Don't jump to remedies. So I'll just show you. See, this is the area. She says, sir, this is the snake bite. Now tell me, can this be a snake bite? She's gone to an allopathic, nursing home. They have given her, steroid, blah, blah, blah. And can this be snake bite? Fine. I asked her, ma'am, I know this girl. I asked her what happened exactly. No, I was standing in the dark and, then I thought something bit I saw. And the girl, small girl who was standing next to me, she said, for me, it looks like a snake. But is this the snake bite? If it was a snake bite, what would have been the local symptom? How would the snake bite look? Knowledge of forensic medicine, toxicology, knowledge of movies, knowledge of Google. Fine. So a real snake bite would have been something like this. A non-venomous snake bite would have been something like this. So it was some small insect bite, we don't know what it is. But this girl was in a panic. Uncle, nothing will happen, no uncle, this, that, etc. So you have to be little careful. The investigations, the progress, the follow up, all those things become very important. So this was not a snake bite per se, it was some insect bite. So this girl was in lot of fear, lot of panic. Now I am relieved that I know this is not a real snake bite. Okay, fine. So I was also tensed. I should have taken a dose of some remedy and then gone to see her. I knew this is not snake bite. This is the snake bite, and this is what the picture of my patient is. Fine. So what is the remedy you think of? Can I have some quick inputs? We are running short of time. 10 more cases to discuss. Can I have some remedies, quick remedies? What is it that you would like to give? Very good. All the 504, they're telling aconite. Beautiful, keep it up. Okay, that suddenness, that anxiety, what we have learned in our materia medica, Aconite, whichever potency I had 1 m. A dose of aconite was given. I spoke to her. Don't worry, I am there. Nothing will happen. Again, morning, she called me, uncle slept very well, very nice, no issues. Okay. So knowledge of disease, aphorism number 3 becomes very important. My pharmacist son, again recently, and there are doctors from my clinic, Nishika Homeo Clinic, who are part of this webinar today. They have seen this case live, and this boy, his brother was driving the two-wheeler. He hit the auto fellow, and the younger brother, who was sitting next behind him, he fell down, and he had bad abrasions. He had pain over the right toe. Then he came to my clinic, rushed to my clinic. Now again here, how do you approach becomes very important. What remedies? What remedies? How do you go ahead? What is your approach? I'm sharing all simple cases, acute cases, bread butter cases. These are the common cases we get in our clinic. Okay. Yeah, simple arnica. Somebody beautifully said simple arnica. I like, they did not tell arnica, they said simple arnica. Beautiful. Appreciate. I made the same mistake. I gave arnica, beautiful. Yes, lot of abrasions. Next day morning, my pharmacist called, sir, my son is in bad pain, is not able to move his foot. Okay, and the foot is swollen. Now tell me what to do. Foot is swollen. Now my question is it a good sign or is it a bad sign? You need to be a little quick if you want more. Yeah, hypericum belladonna. Okay, forget about the remedies. Now my question to you is, somebody says good, somebody says bad. Okay, very good. Okay, so I'll show you what happened. I asked my pharmacist not to waste a single minute. I told him, please go get an X-ray done. Your attention towards this part here. Can you make out? Can you make out? This bone is broken. The impact of the accident, it is broken. So I told him, nothing doing. Take him to the orthopedic surgeon, and they had to fix it. So if you see, understand, sometimes we have to also refer. And these are very few cases we do refer, I don't deny. But this is a mechanical thing which needs the bone which is gone to the other side, it has to be fixed. And don't give symphytum here, don't give ruta. You give ruta or you give symphytum, the bone tells yes, I got symphytum, the bone will not come to its original place. Please don't be foolish in such cases. Use your common sense. It needs to be mechanically fixed. And this boy was referred to the orthopedic surgeon. Done. Another beautiful case. Hope you are getting a gist. Hope I am not too fast. All okay? Can I have a small, till now, whatever I have tried to share with you, are you able to follow, or are you able to understand? Okay.
Yes, Dr. Krishna, you are doing very well at a
Yes,
great
yes,
pace.
yes,
Yeah,
good.
we have to take care of the time also, but you can continue.
Sir, 9:20, is it okay?
Yeah,
Few cases, I'll try to be little quick. I'll show them
because
the.
later we'll take the question answers as well.
Yes, sir. Yes, sir.
So
Yes, sir.
we have to give the time. Yeah.
Yes, sir. Thank you, sir. I understand, sir. Thank you. See,
Right.
Mukher
Yeah.
sir, I know him from before. Sir is very particular about time, but we'll try to cover as many things as possible. Once sir says stop, we'll do it. See now, what I learned from Vijayka sir, just looking at the photo, you should tell the history, what has happened to the patient, what emotions he has gone through. Okay. So please have a look. You know the diagnosis. I thank the patient for permitting me to share this case. We are not disclosing the identity. It is not important for you. See, yes, what do you observe here? What do you observe here? And do you feel it is surgical? Do you feel we can take care of this? What exactly is very important here? The previous case I told we referred. Now, this case we did not refer. Okay. I'll just give you the small history. He is an association in an apartment, and something wrong happened. The worker that was meant for the association work, one fellow used those workers for his personal work, and this guy got agitated and he said, "Sir, what you're doing is not right," and all. And that fellow blasted him, "Who are you to question me?" etc., etc. And after that incident, he started up with hemorrhoids. You have a mental ailment here. I'll show you the images, and if time is a problem, I'll give you the rubrics. But please think what could be the probable rubrics that can come up. So his reaction, I am giving you the reaction. He felt angry. "Sir, it is not right what they are doing." I asked, and then they started blasting me, and I said, "There's no point talking to them." I had a lot of anger. I felt insulted. I came back, and this is the photo after our treatment. Okay, we could prevent him going into surgery. Okay, hemorrhoids from here till here, 2 to 3 weeks time, and a remedy. Okay, so lack of time. I'm giving you the rubric straight. You can take a pick if you want. Anger suppressed from anger, insults from, he had anger for right thing, that is what we call it as indignation. And I also wanted the remedy to cover hemorrhoids. Ignitia, Stephysagria, Natremure, Conium, Chamomilla, Cocculus. To keep it simple, I had given Stephysagria, and you saw the results. Okay, we'll take another case, lot of cases. And when the organizers ask me to stop, we'll stop, respecting the time. A child who had come to my clinic recently, had fever, high fever, and what I told you, observation plays a very important role. So the child had to be carried, but the child would not allow me to examine, nor even father. If we give thermometer, father also cannot touch her, but she has to be carried only by her father. This is the situation. Please think of what probable rubrics can come. I'm directly giving you the rubric. Okay. So what rubrics can come up here? Child is not allowing you to touch. Child is crying. Child is cranky. Chamomilla is a possibility. Yes. Okay. One is chamomilla. But I told you, chamomilla and Sina, they come very close. But here, there's a beautiful rubric in your repertory. Mind desires to be carried, yet dislikes to be handled. The child did not want to be handled. Okay, for example, me touching, dad touching, she did not like, but she wanted to be carried. So I taken this rubric. It might help you. 500 of you watching, it might be a useful rubric in future. Keep this in mind. She beautifully improved with Sina. Okay, yeah, cry. This is one of our homeopath's child. Okay, this is a Google image. It's not her child exactly. 7 months old, very cranky, with fever. She wants to be carried. She gave me a call. I was somewhere outside in Maharashtra. I told, give her chamomilla, no change. And after that, she told, "Sir, when we are carrying also, she is not better. She wants to be rocked." I told, give her Sina. Unfortunately, Sina also did not work. The mother, being a homeopath, she could not contact me, and she herself gave gelsemium and few more remedies. Unfortunately, nothing worked. Fever continues, and I came back third day. They come back to my clinic, and what was that? You know, what is it? Situation, or what was that observation which helped us crack this case is very important. So third day, fever is high, child is crying, not drinking. Mother still has faith in me, faith in homeopathy. She's come back. Fever is not reducing. On examination, child is moaning with high fever. Again, this intelligent, I don't take credit for this case, but the mother, an intelligent mother, homeopath, she told, "Sir, please observe. I have seen something that her upper part is very hot. Please touch her lower part. It is not at all hot. Temperature is 103, 102, but only upper part is hot. And child is moaning. Child is not better by crying, sorry, not better by carrying. So here something we learnt in this case was, yeah, in this case was upper part hot and lower part cold. When they come to you with fever, the only remedy we have is arnica. Do not doubt, do not hesitate prescribing arnica. So she was given arnica. Next 3 hours, generally she was given paracetamol, no paracetamol, fever came down. Next day, the child was very happy and back to normal. So, what was our observation here is a simple physical thing: upper part hot, lower part cold. That was the entry point in this case. Then you had moaning. Must be see that crying also. No, she was not better by carrying. Must be she had. This is what we understood. Crying not better by carrying. Sina will definitely work. If Sina has not worked, then must be that crying when they're carrying is that body is sore. They're carrying and she's crying more. That is arnica. That is arnica. Okay. So 3 months infant, all nice cases, was again brought. See, these are all challenging cases. Fever, vomiting. Okay. And the moment the child feeds, the child vomits. Vomiting is in form of curds. What remedies come to your mind? What remedies? Simple case, but remedies very important. Now I'm asking remedies. I'm not asking you rubrics. Beautiful, Etuza. Good, good, good. Keep it up. Keep it going. Good. Yes. Antimproved Ethusa sanicula, Valeriana, Calcaraca, Psilocybe. These are few remedies from our experience that we have seen. They vomit milk after feeding. Okay. So vomits mother's milk. Please make a note. In curdled form. Only mother's milk. Out of all this, the remedy is Psilocybe. Okay. We don't have time, otherwise we could have had a quiz here. Which is that remedy? The remedy is Psilocybe. Vomits mothers or any form of milk in form of curdled, and the lumps are very large. Out of these three remedies you should keep in your mind when you ask the mother and mother says the curdled thing is large lumps. Ethusa, sanicula and valeriana, three remedies, large lumps. Okay, fine. As soon as the child nurses takes the breast or the bottle, as soon as she feeds, she vomits in form of curds. Okay, small lumps. In Ethusa sanicula valeriana it is large. In antimonium crude it is small. Okay, vomiting from overfeeding. So coming back to our case, I had prescribed this patient anti crude because the child would vomit and the child would again ask for milk, again vomit. In Ethusa, you don't see this happening. Okay, if you read Borix, he beautifully says, fine, they drink, vomit, they go back to sleep. But antim crude, they drink, they vomit, and again they want milk, again they vomit. That is antim crude. Okay, read Borix, you'll get clarity. Sanicula, you have vomiting which is gushing, only remedy is sanicula. Okay, large lumps is sanicula. You can take a pick, no time. I am not going into the details. See, this is a beautiful remedy. When the child is vomiting milk in form of curds, and then you ask the emotion of the mother, and mother is very angry before feeding, or in anger she fed the baby, and then the baby vomits, only remedy we have is valeriana. Please remember, I've used it in the past. Beautiful remedy, valeriana. Okay, okay, we'll go ahead. So what I'm just trying to tell you is, please do not complicate things. Keep it simple. Very important. Okay, we'll go. I mean, I'll directly talk of another case. If I'm a little fast, kindly bear with it because we have 15 more minutes and a few more slides to share. Okay, so a girl aged around 10 years, she entered my clinic crying. She had her hand over the ear and she was telling, Uncle, my ear is paining. Now, again, what do you do? Very important. I'm not asking you, I'll be very happy if you type it on the chat box. But these are all the common things they come to us. Recently, we had this girl with ear pain. First, very important thing you need to do is examine the ear. Is there a foreign body, or is there something? Is it simple inflammation? Is it ASOM, CSOM, whatever it is? Is there a small cockroach? Is there a small insect inside? Yes, you will have to examine. Or is it impacted wax? It's very important. You will have to examine. I examined, there's nothing, but child is crying. Simple rubric, direct rubric. Weeping, pain in ears from. That was the rubric taken. Weeping, pain in ears from. The only remedy we have is pulsatilla. Simple. Gave her pulsatilla, and next day morning she was fine. And acutes, I ask them to keep me informed every 3 hours, every 6 hours. I expect a call from my patients. I tell them any problems, please call. They are my regular patients. They'll not take allopathy. So they keep us informed. So 3 4 hours, the child was absolutely fine, no pain. Okay. This again is a nice case. One of my assistant doctor, she had referred this case. Elderly man, he was having sleepless nights. Okay, elderly man having sleepless nights. So what is the history we have here is this elderly man 2 days back he underwent total knee replacement. Okay, fine. And after the surgery there is no sleep. Done. I'll quickly give you some remedies. I wanted to have an interaction. No time. After operation, cataract operation, if they have some issues related to eye, small filaments or small fragments left over, Seneca is a beautiful remedy. Epistaxis after surgery, it is ferrum phos and thalpsi. And if there are hiccups, it is hyoscyamus after surgery. Vomiting is bismuth, phosphorus, nux vomica, staphysagrия. If it is bloody urine after surgery for the bladder, it is millefolium. Distension of abdomen is hypericum. You can take pics. Cough after surgery is ferrum. Weakness after surgery is strontiana carp, and of course caliphos. So this gentleman had sleeplessness after surgery. Beautiful case. I have videos. He had gone a little delirious. He was in a confusion state. We got his sodium checked. We got all the reports done. All fine. But the only thing we got was no sleep, and this sleep was because of the surgery. From the surgery, after surgery only he had no sleep. The beautiful remedy that will pop up from your repertory is sticta. The girl who referred the case is listening. Beautiful improvement after sticta. The man is back to normal, sleeping well, confusion, all those things are gone. Sticta, sleeplessness after surgery. Sticta. Okay, we'll go ahead. A 80-year-old man had pain abdomen, severe loose stools, feeling very weak, highly offensive, involuntary stools. He was not able to go to washroom, not able to control stools. He was on diaper. This is history. Homeopath's father. I requested her, ma'am, can I present with your permission? She said, sir, let the students learn. Please go ahead. So thanks to all the people who have given me permission to share their cases. Okay. So see, whenever somebody is coming to you with loose stools, involuntary stools, no control over stools, two emotions will definitely be there. Please make a note. One is anger suppressed, and second very important thing is you have no control over the sphincter. You should definitely ask for a fear factor. So in this case, I'm not going into the details. We don't have time. Anger suppressed was there. There was also fear. So I took both. And see, this case also was a surprise remedy. So bad the stools were, odor, that they had to literally put agarbatti at home. Very bad smelling. The daughter called, sir, we are not able to stay inside the house. We generally think of arsenic, we think of soranum, sulfur, etc. etc. But see, report as a tool, what beauty it can do. I took 4 rubrics and 5 rubrics. He wanted everybody there, etc. I had taken this and I had given him stramonium. a surprise thing. Next day, stools normal, no odor. And what should improve first is he got control over his stools. No more involuntary stools after stramonium. Now this is the beauty. They wanted to take him to hospital. I said nothing doing. Please give me some time. And beautifully improved. This boy, quickly have a look. I have 8 more minutes. We'll try to finish. Have a look. See, this will give you the remedy. You should not think of anything. He's moaning with pain. See how he is sitting. This is for beginners, knee elbow position, or where he feels better, putting pressure on the abdomen. So remedy is very clear. You know the remedy, but for me, what is important is the follow-up. I just entered. I'm just asking him, you feel better doing this? And he says, yes, I feel better. Okay. So a remedy given, and within few minutes, you have the boy.
ಪೇನ್ ಅಪ್ಪ ಹೆಂಗೆ இருந்துச்சு ಪೇನ್
See, few minutes after the remedy. And can I have the remedy? Very good, beautiful. Colocin, simple. Colocin. Done. Colocin 1 m was given. And see, these are cases which gives you confidence that our medicines can work like this. Okay. So again, a nice case. Want of time. I'm keeping it short. She lost her purse, wallet in a party which had all her original ID card, what is it, credit card, etc. She placed a complaint with the police, with the manager of the hotel. She did not get. After 2 days, she comes back to the clinic with high fever. Vijay sir would always tell in acutes, please keep the calendar till when you were normal, from when the complaint started. So somewhere here, some Friday, 6th and 9th, she comes to my clinic with complaints. So this shows the onset of the disease was very slow. Okay. So a lot of anticipation, losing so many things, head hot, extremities cold. Okay. And slow manifestation. You have gelsemium, you have bryonia in the repertory, totality. Gels is chilly, bryonia is hot. This girl was chilly. And one more very important point we learned from Vijay sir is, for gelsemium, eye will be very heavy. Okay, I'll just show you a small case. Please appreciate the eyes. Can you appreciate? Drooping of eyelids, heaviness of eyelids. Please focus on this area. My remedy is done. I'm not asking any details. My remedy is gelsemium. He is with fever, he is feeling cold, chilly. Done. No further questions required. Now you observe. Next day he comes to my clinic, see his face, no sweater, see his eye, nothing, all gone. Gelsemium 1 m 7 days. Okay. So yeah, I mean, okay, we can skip this case. I'll just share the other points. Say what I wanted you to understand is eyes, if they're heavy, okay, entry point for you is gelsemium. Dull, chilly, thirstless, heaviness of eyelids, gelsemium. Now acutes. In acutes, what is it that is good? See, headache slash should come. For example, he's got bad cough. From cough, cold should come. Only then it is cure. Hering's law, even in acutes, are very important. Well-being of the patient after your medicines, they feel healthy, they feel strong, they feel normal, good, and they are going towards recovery, cure. Patient regaining lost interest. These are all good signs in acutes. Elimination, a diarrhea coming up, a sweating coming up is a good sign. Improvement in the investigation. Okay. What is bad? The patient feels more drowsy. The energy levels have further reduced. It's a bad sign. Okay. And the disease progressing. From the knowledge of disease, aphorism number 3, You know, he had come to you for cold and now he's gone into bad cough. It's a bad sign. Disease has progressed. It's bad. Okay. You know, in acutes or even otherwise, homeopathic remedies, they're very rapid. The cure should happen in a rapid way, gentle way, and permanent way, told in organon. And this image makes a lot of sense. For the giraffe, she is right, or he is right, the giraffe, I don't know the gender. But you know, being unprejudiced observer is very, very important. Okay. So the concluding statements, homeopathy is three-legged stools. I've told in many seminars. I'm telling the same here. Knowledge of materia medica, organon, repertory, and of course, the allied science, whatever it is, surgery, physio, anat, medicine, gynec, all those things are very important to become a holistic healer. Okay. This I'll not go into the details, but for an acute totality, you need to keep the elements in your mind, the activity, hunt for a PQRS, see for the thirst, see for the thermals, see for the modalities, and look for the concomitants. This is what makes up the acute totality. Acute totality. So same thing told in a different form. Okay. This small reel teaches you a lot. What was that eagle doing before catching the prey? The eagle was practicing. And these webinars, these seminars, the classes that you attend in your college, they're all the practicing things. You know, when you are there having your own clinic, your own setup, or you've already had your own clinic. So this acquiring knowledge, practicing, being in touch with the community is very, very important. So before I take up your questions, I would like to thank all my patients for allowing me to share their details, and I would also like to thank IIHP. Special thanks to Shivani Parik ma'am. Samir sir, special thanks for joining from Istanbul, and Arunodaya Rao, Dr. Arunodaya Rao, and Dr. Shivakumar, Dr. Sangwan, and Muktinder sir, and many senior practitioners. And of course, though it's a Sunday, 500 of you have come out, meaning have shown interest to join. So it's a very big thing. Hats off to all of you. Let that learning thing in you continue. So thank you so much. Any questions? And anyway, questions, I don't know what all you have asked. Now this is me. Okay, you can see, this is my YouTube channel. You can have a look, and I have also given you my mobile number. Any feedbacks about today's session, please feel free. Okay. And thank you so much, and we will definitely come back to the questions if at all there are any. So thank you all for joining, and over to you, ma'am. Let me know what questions have come up, and we'll try to answer. Thank you so much. So any quick questions if you have? Let me also just go through quickly. Uh, Last case medicine, one second. Which was that last case? One second, one second. Let me just see which was that last case. Okay, was this one? One second. Okay. So see, this is Gelsemium. I told you, like, last case, both the cases of that girl who lost her wallet and then she went into anticipation, landed up with fever, but fever developed slowly. So belladonna, aconite is not the remedy that you should think of. The remedy we gave was gelsemium. The remedy given was gelsemium. Okay. Okay, 1 second. Yeah. Any further questions? See, potency, I've already told you, what was the medicines in hemorrhoid case? Hemorrhoid case, I told you, Dr. Poonam, it was stephysagria. And potency, I've told you, generally I use 1 m or higher. I've used 10 m, 50 m in acutes with beautiful results. Okay. Can you please reshare the post-surgery symptoms? 1 second, let me just have a look. Yeah, 1 second. Yeah, 1 second. It's all there in a repertory. If you want, you can take a pic. Cough after surgery, weakness after surgery is caliphus and stanchiana carp, ferrum. And this is what we saw: vomiting, hematuria, distension of abdomen. Surprisingly, the remedy mentioned is hypericum. I don't have any personal experience, but is given from a reliable source. Okay, and this were few more remedies that we discussed. Okay, let me see if there are any more. See, there's a nice question. How do you differentiate magnetism and clinging? See, magnetism and mesmerism, you have a rubric. See, generally in my clinic, when do I take magnetism is when people say they need to be pressed. For example, somebody should keep pressing them. This is when I take the rubric magnetism desires to be. But when somebody wants to just hold them, or they're just, see, cling means to stuck, getting attached. Fine. So clinging, especially in acutes, you see in clinic, kids are clinging to the mother. Okay, done. Okay. So why not antim tart in the first case and why phosphorus? I was very clear there. Antim tart clinging is mainly in respiratory affections. Must be if she had cough, if she had wheezing, I would have definitely thought of antim tart. And I can share you 10 to 12 cases where antim tart has done wonders. From emergencies, we have brought the patient out, antim tart. But here it was more respiratory, more of vomiting. Fine. So that's why uh, phosphorus. See, giving a wrong remedy, if you read Organon, Sarras, Animan Sarras beautifully told, it will not have any effect on the vital force. It will not do anything harm. So don't worry. For example, in that case, if I would have given antim tart wouldn't have done anything, but the disease would have progressed. She would have landed up in an hospital. And my final year students should have lost faith in homeopathy, faith in me. Done? Okay? Yeah, let's see if we have any more questions. See, I've seen you selecting a remedy based on only one or two. See, this is the art. You passionately practice homeopathy for 30 years, and then you will get this art. It is not a difficult thing. Don't take 10, 20, 30, 40. It will not make sense. Acutes, you will be wasting time. You have no time. You should enter through that rubric, which definitely covers all your 20 rubrics that you mentioned. And that is what we call it as an entry point. So entry point should be very strong. I know I take very few rubrics. This is what we have learned from Vijay sir. None. It doesn't mean you have to dump in your repertorial sheet with 20, 30 rubrics. It will not make sense. That entry rubric, that 153 aphorism, that is something which is striking, rare, peculiar. That is what you have to enter with. Then you add all those 20. Trust me, take it as an assignment. You'll see all the 20 symptoms you have taken. Again, same remedy will come. Why waste taking 20 rubrics? Take that peculiar thing and enter. It's a beautiful thing. Okay. Anything else? So majorly, I feel we are covered, and if there are more doubts, you can always get back. We'll be in touch, and we'll try to definitely share. Okay. Thank you once again for your time on a Sunday, and hope the seminar was useful, and I'll be happy if you apply and get more results. Please stick to homeopathy. That's very important. That is the take home message for all the youngsters who have joined. It's a beautiful science. It works beautifully. You'll have to just have some patience, stick to the science, and it'll definitely take you to greater and greater heights. Thank you once again for joining. Thank you, IIHP, for the opportunity, and of course, special thanks to Muktinder sir. Thank you so much.
Yeah, Dr. Vijay,
Yes, sir.
congratulations to you
Thank you,
for
sir.
your precise and very compact viewpoint and with cases and with the vision about treating the acutes. I do uh, have practiced this acute chart, and I am also a direct disciple of Dr. Vijay sir for many years. So this has really transformed our practices when we started using it in early late 90s or early
Yeah.
2000, and that was a the turning point of our all of us our practices, because this activity thermal thrust chart, that was something which we memorize on tips, and Dr. Vijay used to say that uh, homeopath, if you want to practice homeopathy, you have to have this book by heart. So
Yes,
that
sir.
only 60 remedies which he covered, those
Mm.
60 remedies, they really are the real survivor of our practice and our patients.
Yes, sir.
So
Absolutely.
this has made opened so many doors for us and so many opportunities for us in our practices. I think if we are established practitioners today, this acute chart and acute understanding of Dr. Vijay sir has contributed, and it is the rather uh, the base of our practice. So you have justified it well. So I was remembering many of similar cases. I'll just quote one. As you told that there was an irritation with the cup. I once had a case which was very stubborn, and it was boy who was a footballer. He just came to me and told that after cuff, I get itching into my garments after cuff. So it
Mm.
was a very peculiar, and when I saw the remedy coming was Ambragracia. So I
Mm.
just straightforward asked that what has happened? Where did you feel embarrassed? To
Mm.
confirm the remedy, I told that I was protecting the goal and it passed away. It was a silly mistake on my part. So
Mm.
that tarnished my image. I'm a good player, but I did a silly mistake in front of whole school, and that just I felt embarrassed. And that moment I started coughing, and it is still going on and on for so many days despite antibiotic courses. So that picking up the right rubric, as you said, because our repertory is GIGO rule: garbage in, garbage out. You put anything, you get anything. If you put anything which is peculiar, you get the peculiar remedy out. So it is just like a boomerang, it is like a mirror. Whatever you put, it will come out as it is. So your statement of taking very few rubrics is I endorse that, because in my practice I have also felt, and all of us which are practicing on classical homeopathy and getting results, because in acute there's no point of taking so many rubrics and large rubrics in particular. People, what do people do is people take this approach in chronic and psychotic cases where it is very dangerous to take smaller rubrics and few rubrics which won't represent the personality. But in acute, so actually, we have been seasoned in such a way that we have only one way of practicing. While in organon, it is told that there are different approaches at different times. So the one homeopath who can learn this art is who knows where to use which tool. So if you are using right tool, you are getting the right output. So I congratulate you, and I congratulate Dr. Samir. I congratulate Gujarat IIHP Gujarat unit on behalf and on the post of being IIHP Scientific Committee Chairman. So I really appreciate the efforts done by Gujarat State in very short time, Dr. Sameer. Uh, Congratulations to you and Dr. Shivani. She has been following me for Zoom and everything. So I know her enthusiasm and her dedication. So congratulations to all of you. Thank
Thank you,
you.
sir. Thank you very much, sir. Sir, now vote of thanks by Dr. Swapnil Naik will be there. And before that, I just want to give a thanks to Vijay Krishnan, sir, on behalf of Dr. Samir, as he is in Istanbul. So thank you very much, sir, for your excellent presentation. Uh, Thank you very much, sir. It was really very nice on acute cases. Yes, sir. Thank you very much, sir. Dr. Swapnil, Dr. Swapnil,
I think we need to unmute her if she is available. Swapnil, and what she has joined on what Swapnil Naik. You can ask Dr. Swapnil to uh, unmute herself. Yes, Dr. Swapnil, you can now talk. I think Dr. Shivani, you have to do that. I think she's not able to talk.
sir, Muktinder, sir, he is there.
Yes,
Sir, he is there. Dr. Swapnil has come.
may I think I have asked her to him to unmute, but he's not audible right.